Tonight,
I couldn't swallow.
We were able to identify that she had a larynx cancer.
an ABC 27 special presentation.
Having a diagnosis of head and neck cancer can be very devastating for the patients.
I gotta fight for my life, for my family.
Head and neck cancer, a matter of facts. Sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. April is Head and Neck Cancer Awareness Month. Tonight, a Lancaster County woman shares her courageous journey when diagnosed with head and neck cancer. Also learn about the importance of research and clinical trials and meet a patient who is participating in one of them at Penn State Health. And specialists are here to answer some important questions like what are the signs and symptoms of head and neck cancer? Can head and neck cancer be prevented? And how do clinical trials make a difference? And if you have questions at home, Denise McCracken is here to tell you how to get them answered. Hi, Denise.
Hi, Deborah. Thank you. Specialists with Penn State Health are here tonight answering your questions in a live web chat until 8 o'clock. If you have a question at home, you can submit that at abc27.com/head and neck. And I'll be back later in the show to share some of those with you. Deborah.
Thank you, Denise. As I had mentioned, April is Head and Neck Cancer Awareness Month. A Lancaster County woman wants others to be well aware of one of the risk factors for head and neck cancer. Melissa Baker shares her journey.
If you're a smoker, stop. Keep yourself. You will feel so much better.
A strong message heard loud and clear from 45-year-old Melissa Baker. Her journey began as a teenager when she started smoking for a number of reasons.
Stress. Just wanted to do it and try it.
Melissa smoked 1 to 2 packs a day. Over time, she developed symptoms that she blamed on the cigarettes.
I couldn't swallow. I had a lot of trouble eating. A lot of pain in the right side of my ear, going down the side of my neck.
A key part of any evaluation is really getting that history. So, we talked about a lot of our risk factors. And then, the nice thing about what we do is we're able to get cameras in while patients are awake, so we can put a camera in the nose and take a look directly at the back of the throat in the voice box. And in doing that, we saw a mass there. We saw something that didn't belong.
A biopsy confirmed larynx cancer. The Penn State Health Head and Neck Cancer Team provides support to patients receiving this news.
These patients require a lot of emotional support, and that's what I'm here for, to kind of bridge the gap between the medical diagnosis and the caring part of taking care of patients and the emotional support.
Support needed when patients hear the recommendation from a doctor.
Based on the size and also based on the fact that she wasn't really speaking all that well, based on the fact that she wasn't really swallowing all that well, we had recommended removing the voice box. And that's never something we take lightly. We're taking away potentially someone's ability to speak and communicate with the world. However, we also have to think about what's going to be the safest and give her the best chance of survival.
Initially, Melissa said no.
But I let him do it because I want to live. I trusted him.
When we talk about removing the voice box, we're literally removing the voice box. So we take out the larynx, we take out a portion of the trachea, and then we have to reconstruct the esophagus, which sits behind it, the food pipe, to create a swallowing tube for patients to swallow safely.
I was up 2.5 hours later walking around. I said, "You're not getting me down, I'm getting up."
About 7 months later, Melissa had another very important procedure.
She has a tracheoesophageal prosthesis, or a TEP. And what that is it's a one-way valve that sits between the trachea and the esophagus. So the trachea is coming out to the neck after this surgery. And so when they cover the hole where the air is coming in and they breathe out, they can force the air through their food pipe and back through their mouth to create voice.
I got my voice like 2 months ago.
When asked how does that feel, she responded quickly.
Awesome.
It does give her a voice and allows her to, maintain as much normalcy as possible with the permanent removal of the voice box.
Melissa says her family and faith guided her through this unexpected journey, along with her determination to help others.
After your laryngectomy, you can go on living your life just as you were before. It's so much better. because you feel better. Gotta be positive, stay focused on recovering, and keep going. Help others as much as you can, be inspirational to them.
And Melissa is an inspiration to so many people. After surgery, she did need chemotherapy and radiation. Today, Melissa says she feels amazing and she is so happy to have her voice and really wants to provide support to others. And joining me right now is Dr. Neerav Goyal, Chief of the Division of Head and Neck Oncology and Surgery at Penn Health, and also Melissa's surgeon. Thanks for being with us.
Thank you.
Really, what an amazing story. Melissa really just wanted to share her story so she can help others. Let's talk about smoking and the risk factors.
Sure. Yeah. I mean, I think we've seen there's plenty of research to show that smoking, unfortunately, can lead to a lot of cancers, including the cancer that she had, a voice box cancer. I think it's important for anyone to know that stopping smoking can really reduce that risk within the first weeks, months, or years of stopping. So just putting down that cigarette can really have a huge impact of not having to have the same treatment or experience the same cancer that Melissa had to experience.
Now, Melissa is doing great. She is so grateful to you that she does have a voice. How does that make you feel?
I think it's really amazing. You know, it's part of why many of us go into the specialties we chose, is that we have the ability to have a direct impact on our patients. We're able to cure a cancer and really help restore function to patients to allow them to communicate with the world.
Talk to us about some of the other risk factors for head and neck cancer.
You know, the biggest risk factors for head and neck cancer for many years has been smoking, chewing tobacco, alcohol. I think one that's come up more recently is the role that viruses play in causing cancer, specifically the human papillomavirus. So we are seeing patients who are developing cancers of the tonsil or the back of the tongue because of this virus.
So talk to us about treatment options.
Yeah, so I think as we saw in, in Melissa's case, she had surgery and she also had chemotherapy and radiation. Ultimately, we want to find the right treatment for each individual patient. For some patients, it could be surgery alone. For other patients, it may be radiation alone. And for other patients, if the disease is advanced enough, they do need all three therapies.
And how about robotic surgery? That plays really a huge role in this now.
It really does now, and it's been amazing what robotics has done for head and neck cancer. We've been offering robotic surgery for over a decade now, and it really allows us to treat patients, treat their cancers through smaller cuts with less pain, less morbidity, and keep them cancer-free.
And recovery, like you said, is so much faster when you use robotics, correct?
And when it's the right thing for the patient, it makes a big difference for sure.
Okay, Dr. Goyal, thank you so much. We're going to talk to you a little bit later in the show. And if you would like more information or if you would like to make an appointment with the Penn Health Head and Neck Cancer Team, you could call this number 717-531-6822 or visit online at pennsayhealth.org. Let's check in with Denise McCracken. So what are some of the questions being asked, Denise?
Thanks, Deborah. We have a wide variety of questions coming in tonight, and joining us is Dr. Guy Slonimsky, head and neck surgeon at Penn State Health. Thank you so much for joining us tonight. Our first viewer question is, I know Penn State Health has multiple locations. Are you currently seeing patients in Lancaster?
Yes, absolutely. I have 2 days of clinic a week at Lime Spring location in Lancaster. The other days, patients are seen by our physician assistants, so we have a full clinic going 5 days a week. I also operate on patients in Lancaster at the new Penn State Health at State Road. And patients also benefit from me being able to consult my colleagues at the main campus at Hershey and sometimes refer patients to there. So we can really provide a very holistic approach for all head and neck conditions.
It sounds like it. Our next viewer asks, I've had a sore throat for a few months. When should I be concerned and see my doctor?
So, assuming this is an adult asking the question, chronic sore throats are not uncommon. And it's important to remember that most of them will be due to infections, reflux disease, for example, or acute conditions that eventually go away. But if sore throat persists, especially if the patient or the person asking the question is a smoker or consumes alcohol on a daily basis, it's important to be checked. If this condition persists over a few weeks, they should be seen by at least the primary care physician, and if the primary care physician has concerns, a referral should be placed to us.
All right, thank you. That's a lot of great information. If you have a question for the specialists at home, go to abc27.com/head and neck. Stay with us. We'll be right back.
The best teams attract the best talent. That's true on the football field and beyond. As Penn State Health opens new locations across Central PA and delivers superior care at its existing hospitals and clinics, it's looking for talented people from all backgrounds to fill positions throughout the organization. Think you got what it takes to join an exceptional healthcare team? Apply today at pennstatehealth.org/careers.
You're watching Head and Neck Cancer, a Matter of Facts on ABC 27, sponsored by Penn State Health.
Welcome back. Joining us is Dr. David Goldenberg, Chair of Otolaryngology, Head and Neck Surgery at Penn State Health. Now, we talked about risk factors, but why don't you talk to us about some of the symptoms of head and neck cancer?
Well, symptoms can vary depending on where the head and neck cancer affects the patient. So if it's in the larynx or voice box, typically it would be hoarseness. If it's in the mouth or oral cavity, it could be a sore that doesn't heal. And if it's further back in the oropharynx towards the swallowing passage, it could be difficulty swallowing, a feeling of something stuck in your throat, or pain in the affected ear.
So some people may say that these symptoms are, it could be a cold or it could be something like that. So when do you know that maybe I really need to get this checked out, because this seems like it could be a little bit more serious?
That is a great and really important question. Everyone gets colds, they get sore throats, they get hoarse. However, if you have one of those symptoms and it persists for more than 2 or 3 weeks, then it's not just a cold. And if you are someone who's at risk, perhaps a smoker or a smoker who drinks alcohol, then you need to take these signs and symptoms seriously, especially if they don't go away.
So what is the next step? Is a screening? Is that what the next step would be? What would you say to the doctor?
Well, typically a patient will come in and say exactly what we just said, that they have a sore throat or they're hoarse for 3 or 4 weeks. Oftentimes people will come in with a painless lump in the side of their neck and nothing further. And we say that anyone above the age of 40 who has a lump in the side of their neck needs to be checked out, regardless of if they just think it's okay.
So what is a screening, and how does a screening differ from, say, years ago?
Well, we call a screening when we take a population that is presumed to be unaffected by the disease or any disease, and they come in and we check them to see if perhaps there's something early that, they have a head and neck cancer and it's either vague or it's too early to detect, or their symptoms are still in that 2 to 3 or 4 week period, or they have a neck mass and they think it's nothing, my cousin just said it's a lymph node type of thing. Those are the patients who benefit the most from a screening. But, we're holding this screening at Penn State Health in April. I believe it's on the event is on April 24th. And it's meant for any adult, but especially those who are at risk for head and neck cancer, people who smoke or people who smoke and drink alcohol.
And that's what I was going to say. So this is really open to anyone. So if you are, say, having one of these symptoms, this is something that they could come to.
Sure, and even if you're not having symptoms and you're just worried and you just want to get checked out, that's why we do it. Luckily, most of the people who come in for the screening are just fine. But every now and again, we find someone who has a head and neck cancer, and because of these screenings, we find it early, and early detection gives you, the patient, much better outcomes.
And what will happen when you do the screening?
Well, typically the patient comes in and one of our physicians will ask them to open their mouth and take a look inside and feel their tongue and tongue base and look at their tonsils and look and feel their neck for neck masses. And that's about it.
Okay. Now your team really has expanded across the region from Hershey to Cumberland County, Lancaster. Why is this so important?
Well, as Penn State Health grows, the services that we offer, we want to bring out to the community. Sometimes patients come from really far and wide to be seen, and sometimes they just don't have the proper conduit to get in. So we go out to the community, and we've opened up these offices in those areas to be able to serve the community better.
And one way of serving the community better is certainly through research, and that is absolutely critical. We're going to talk a little bit more coming up, but let's talk about the fundraiser to benefit head and neck cancer. This is something that you're hosting. Tell us about it.
We're hosting a sporting clay shoot on May 19th at 9 in the morning at the Palmyra Sportsmen's Association to raise money for our head and neck cancer research endeavors. We've had every year, this is the 4th year, every year it's grown. We have wonderful sponsors, and that money is put to great use, and it allows us to do the clinical trials that we're discussing and to just open up a lot of the research projects that we need to help our patients.
Okay, lots of really good information, Dr. Goldenberg. Always good seeing you.
Lovely seeing you. Thank you.
And if you would like more information, or if you would like to make an appointment with the Penn State Health Head and Neck Cancer Team, you can call this number, 717-531-6822, or visit online at pennstatehealth.org. Let's check in with Denise and get some answers to more of the web chat questions. Denise.
Thanks, Deborah. Well, joining us is Erin Sarsfield, Clinical Coordinator of Head and Neck Surgery at Penn State Health. Thank you for being with us tonight.
Thank you for having me.
Our first viewer asks, do you have a support group for head and neck cancer survivors?
Yes, we do. We have a wonderful support group made up of patients, survivors, and their family members and support people. We meet once a month at Penn State Health on campus, and everyone is welcome, and we support each other through this journey, and we also have a lot of fun and develop really nice relationships.
Sounds like a very supportive place to be. Our next viewer asks, are there lifestyle changes or preventative measures that people can take to prevent head and neck cancer?
That's a great question, and the answer is yes. Although not all head and neck cancers are related to smoking and drinking excessive alcohol, some are, and that is the best thing you can do for yourself, to stop smoking, stop chewing tobacco products as well, and to, of course, avoid excessive alcohol intake. The other way you can prevent head and neck cancers is to get your children vaccinated against the human papilloma virus, which some of the cancers of the head and neck area are related to. And there is a vaccine, it's a 2-part vaccine, recommended for children actually from age 9 on up. And the hope is that if the children get vaccinated against this, then we will not have these cancers in their adulthood.
Our next viewer question is, what type of support does the Penn State Health Head and Neck Cancer team offer patients?
Well, for our head and neck patients, we work as a team. We have various professionals that work together. We have nurses such as myself and social workers who provide emotional support and help getting through the diagnosis and treatment of these cancers. We also work very closely with our speech and language pathologists, who are wonderful integral members of our team, and they help patients deal with the side effects of treatment and the changes that come to their swallowing and their speech and even their taste. So they also help us as well. In our Cancer Institute, we have a comprehensive care center that has a lot of resources for patients and helps patients get the resources from the community that they need to help deal with their cancer.
I do have another question regarding the HPV-related cancers. What is the prognosis of that if someone is diagnosed with that?
Yes, that's a great question too. Actually, the prognosis is very good for treating these cancers. It's about an 85% survival rate. So it's very good. These cancers respond very well to the treatment. So that is a positive note.
Well, thank you so much again to both of you for joining us and answering our questions. You've given us a lot of great information.
Thank
and you
you
will be here until 8 o'clock, so if you have questions at home, you can submit those at abc27.com/headandneck. Back to you, Deborah.
And thank you, Denise. Dr. Goyal is back with us along with his patient, Joe Lacue. Thank you both for being with us again. So Dr. Goyal, research is certainly an important thing. Talk to us about a current clinical trial you are involved in.
So we are actually looking at a lot of clinical trials, and a big focus here at Penn State is figuring out how we can give effective treatment for cancer while minimizing the side effects of the treatment. So Joe here was involved in a clinical trial where we're looking at whether or not we can give chemotherapy with the radiation in potentially smaller doses over a longer period of time, and to see whether or not that has a difference in the side effects that patients face.
And Joe, why did you decide to be involved in a clinical trial?
Once I got diagnosed with neck cancer, we decided to come down here to Hershey, Penn State Health, and Dr. Goyal, I met with him, and I talked to their team of physicians, and they explained the program to me, and I talked it over with my family, and we decided if there was a way that we could help other patients with treatment, we'd be happy to do that, and that's how I joined the program.
Yeah, and that's such a good thing because you are making a difference. Dr. Goyal, how critical are clinical trials, and what do you hope to happen one day?
Sure, yeah, I mean, clinical trials are essential. It really is the way that we change how we treat patients as our standard of care. If we think about the treatment that Joe had in terms of chemotherapy and radiation, that treatment paradigm only came about because a previous clinical trial showed that it was effective for our patients. So clinical trials are essential in helping minimize treatment, to give just the right amount of treatment to keep the cancer away and make sure that the side effects are as little as possible.
And Joe, how does it make you feel to know that you are making a difference by participating in a clinical trial?
Well, I know what I went through with radiation and chemo, and if there was any way that the next patients would have it easier, that would be thanks enough, and hopefully in the future that, we learn from this, and there's a very good team at Hershey there that got me through it.
And how are you feeling today?
I feel great today.
Oh, good for you. Dr. Goyal, we really are so fortunate to have Penn State College of Medicine and research happening right here in our backyard. Talk to us about that.
Yeah, so I think it's great because the College of Medicine, really one of the pillars is to look at novel treatments that can directly serve our community. And with the College of Medicine here, with the resources of our Cancer Institute and the Penn State Hershey Hospital, we're really able to leverage how do we bring novel treatments, how do we bring the newest, the latest options for patients who may have no other options, or ways that we can potentially reduce the side effects of treatment, like dry mouth or changes in taste. All of this research is happening at the College of Medicine in coordination with the Penn State Health System.
We received so much great information tonight. What advice do you have for someone who may be watching, who may be newly diagnosed with head and neck cancer? What would you say to them, and how would you encourage them, or why would you encourage them to choose Penn State Health?
I mean, I think that new diagnosis, we know it's life-changing. We know that the treatments associated with it can be life-changing, but it's really important to have a cohesive, comprehensive team behind you. I think as Erin mentioned, you know, we have nurses, we have our speech pathologists, we have our therapists, we have the doctors, the radiation doctors, the chemotherapy doctors, and the surgeons, all working together in a coordinated way, communicating with each other to really provide an individualized treatment for our patients that can afford them the best options moving forward. So no matter where you go, you need to have that coordinated team. I think what Penn State offers is that comprehensive package for our patients to allow them the best outcome possible.
Okay, thank you both for all this information tonight. We certainly appreciate it.
Thank you.
Thank you.
You are welcome. And we do send a special thanks to Melissa and Joe for sharing their stories, and you, our viewers, for sending in your questions. If you would like more information, or if you would like to make an appointment with the Penn State Health Head and Neck Cancer Team, you can call this number, 717-531-6822, or visit online at pennstatehealth.org. Now, there are a couple of events coming up that we would like to mention again. On Wednesday, April 24th from 6 until 8, there are free head and neck cancer screenings. They will take place at the University Physician Center at Penn State Health Hershey Medical Center. This is the number to call to register, 1-800-243-1455. Once again, 1-800-243-1455 to register. And you don't want to miss the 4th annual Sporting Clay Shoot fundraiser. It is happening on Sunday, May 19th at 9 a.m. at Palmyra Sportsmen's Association. You can scan the QR code to purchase tickets, sponsor the event, or make a donation. The proceeds benefit head and neck cancer research at Penn State Health. Well, we certainly have received a lot of information tonight about head and neck cancer. Once again, you should attend that screening if you have any concerns. We want to thank you for watching, and we wish you good health.